Today I wanted to talk to you about delayed cord clamping and what it is and why you might be interested in doing it. So what it is after the baby is born, but before the placenta has been delivered. It's when your provider waits a minimum of 60 seconds to let the blood pulsate back into the baby through the umbilical cord. So it's all that nutrient-rich blood flowing from the placenta back into the baby. And when it's done pulsating, the umbilical cord will look sometimes kind of white or very pale and like very flat. It looks like there's no blood in it because it's not. It's all been received by the baby. And the reason you might do this is because benefits show that when your provider waits a minimum of 60 seconds, babies have a greater chance of not having any iron deficiencies and having greater iron levels, at least until the first 4 to 6 months of life. So our hospital does not routinely practice this, but it is regularly requested, and so they're very, they'll work with you and do it. They're happy to do that if everything's okay and the situation can allow. So anyways, that's why it might be done, for iron levels later for the baby. Also for the baby to get all that nutrient-rich blood, and that way you save that blood rather than essentially throwing it away. If the cord is cut while the blood's still in it, it just essentially gets thrown away rather than being put back into the baby. So that's why people might do it. Originally, it is recommended for preterm and full-term babies. Originally, people thought that for full-term babies, it might have an increase in them getting jaundice, but research has shown that that is not the case. So if you're researching delayed cord clamping and thinking about doing it, you might come across the jaundice situation, but that has shown that they have no links. Delayed cord clamping and full-term babies getting jaundice, they're not linked together. So anyways, I hope that's helpful, and if you are interested in doing that, you just have to talk to your provider about it, and if the situation, is everything's okay, I'm sure that they'll be happy to do that. And like I said, it's just a minimum of 60 seconds, and that can do great things for your baby. So anyways, have a great day. Bye.